Welcome back. Now we're going to talk about some hand issues. Dr. Jason Rehm is with us, a board-certified plastic and hand surgeon with the Plastic Surgery Group and Hayes Hand Center. And he's here to talk about some common problems. Like I mentioned a moment ago, trigger finger. Now, yes. I think of trigger finger like, you know, you go shoot somebody or you got a muscle that pulls right. or something.
Sure.
What is it?
Trigger fingers are a real common problem affecting people of all ages, but generally when they're in their 50s and 60s. But it's what they describe as a catch in flexion and extension of the finger. And thus that's where the trigger name comes from. But basically it's an inflammatory response around the flexor tendon, or the tendon that allows you to flex your finger. And it starts to catch on a band of tissue in the palm. And then when you flex and extend the finger, it'll catch or click, or commonly a complaint is that when somebody wakes up in the morning, a finger or thumb is stuck in the flex position, and they have to actually take the other hand and pull it to straighten it.
Now, how serious is that? Does it require surgery?
Occasionally, sometimes it does. It's serious in that it affects people's lifestyle quite a bit, and that their fingers always get in the way, and it's painful. But a lot of times we're able to treat it with conservative measures, in particular a steroid injection into the region around the tendon. A steroid is a strong anti-inflammatory, and a lot of times, about 60 to 70% of the people, that will knock down the inflammation enough that the tendon starts to glide or slide through better, and that does it for them. The people who fail those steroid injections will require a surgery that we do in the operating room under a local anesthesia to release the band of tissue that's catching that tendon and causing the friction, and thus the sticking or popping or clicking.
Yeah. All right, now there's some kind of tendinitis here. I can't even pronounce that. What is this?
De Quervain's tendinitis.
Okay, what is that?
That's similar to a trigger finger in that it's an inflammatory response around a tendon. Anywhere that a tendon crosses or makes a sharp angle or goes through a tunnel, there's friction, and it can cause inflammation. And this type of tendinitis is a tendinitis of the tendons that actually allow you to extend or bring your thumb out. It occurs on the thumb side of the wrist, and in a similar fashion, people have pain, swelling in that area, and it's related to inflammation around those tendons. And similar to a trigger finger, it's commonly treated with a steroid injection. Sometimes splinting, anti-inflammatory medications, and then those who fail those sorts of management measures will end up with a surgical release of those tendons, and we're able to improve the inflammatory response there and improve on the pain.
Yeah, something that maybe is more of an annoyance than anything else, but still yet if it causes pain, it's discomfort, you don't like to do it.
Right.
All right, next up is ganglion cyst, and I know about those things. I had one removed about 20 years ago.
Right. They're also real common hand and wrist complaint. It's just an area of swelling or a localized swelling. What it is a fluid-filled cyst. It's typically, it starts, anywhere you have a joint, you can have a ganglion cyst. They're just really common in the wrist and the hand. They used to call them a Bible cyst. That's what a lot of people who come in, they comment that someone has called it that before. But the ones on the back side of the hand, they used to just compression, or they used to say they would smack it with a book and it would go away. But and that's the name. But what we do now is we'll frequently aspirate it with a needle, try to remove the fluid. We haven't removed the cyst, but sometimes we can get it to compress down and heal. Those that come back or that are problematic, they too can be painful because of pressure there, and they tend to be slow growing and problematic that way. Then those people will take to the operating room and excise and actually remove the entire cyst, the cyst wall, all the fluid, and the place where it originates down at the joint. And they're usually successful in getting those to stay away. Boy,
that is interesting information on those three issues and problems. And by the way, if you would like more information, you can get in touch with Erlanger's 778 link number that is always underway. Dr. Rehm of Plastic Surgery Group and the Hayes Hand Center. And again, 778 link 778-5465. Thank you for being here. We appreciate it very much. Now, let me tell you very quickly about tomorrow's program. We're going to talk about REACH, which is an adult education center in Cleveland, Tennessee. We will also be talking about losing something, like weight. That could be good for your joints, I think. Stay classy, Chattanooga. Remember to try a little of this and a little of that. We'll see you tomorrow at 12:30.